United States today, supplements are a multi-billion-dollar industry. By and large, the supplement industry has managed to go unchecked by regulatory bodies such as the FDA. Unlike pharmaceuticals, which must meet a very high standard for safety and efficacy, supplements need only meet a few requirements. Under the Dietary Supplement Health and Education Act of 1994, known as DSHEA, supplements, such as dietary supplements, were placed in the same category as food, which allows supplement manufacturers to play by a very, very different set of rules. One of the biggest differences is in philosophy, in the way that supplements are approached by the FDA. While pharmaceuticals are considered unsafe until proven safe, just the opposite is true with supplements. They're considered safe until proven otherwise. The DSHEA Act says that dietary supplements cannot contain anything that may have, quote, a significant or unreasonable risk of illness or injury, unquote, when the supplement is used as directed on the label, or with normal use if there are no directions on the label. In addition, the FDA demands that an individual supplement must contain exactly what the label says that it contains. Other than that, there's not much more. There's no clinical trials required. The FDA can step in and stop the production of a supplement, but only after the drug has caused harm. For the most part, the complete opposite philosophy is employed in standard medical grade drugs. However, supplements are marketed vigorously, and many Americans take them every single day. A recent publication that spurred this blog in the Annals of Internal Medicine showed that most, if not all, supplements intended to improve heart health and cardiovascular mortality were found to be ineffective. In this big meta-analysis, nearly 1 million patients who were taking various supplements were evaluated and found that there was no real evidence of improved outcomes. In fact, some supplements, for example, the combination of calcium and vitamin D together, seem to actually increase the rate of stroke in some subjects in these studies in this meta-analysis. So how in the heck did this happen? Why does it continue? And what can we do? Well, you guessed it. The simple answer as to why it happened, it all comes down to money. Senator Orrin Hatch, the former senator from Utah, was the author of the DSHEA law in 1994. He profited greatly from it, and I'll show you. His family is invested in supplement companies, including Herbalife, who had some troubles. Between 1989 and 1994, Herbalife International gave Hatch $50,000, Metabolife $31,000. Others gave them a sum of $88,550. In addition to this, according to his financial disclosures for 2003, Hatch owned over 35,000 shares of a Utah-based nutritional supplement company. In the early 90s, Hatch's son, Scott, began working for lobbying groups representing vitamin and supplement makers. Kevin McGinnis, Hatch's former chief of staff, was also a lobbyist for the same industry. The supplement industry has thrived in the state of Utah, and thanks to Senator Hatch, the industry has really grown unchecked, all while patients continue to be misled and possibly harmed. In fact, the corridor of Interstate 15 in Utah is known as the Silicon Valley of the supplement industry. To answer what can we do is really far more complex. It starts with physicians taking a stand and responding to the misinformation found on supplements in the media and on the internet. Social media leaders such as Dr. Eric Topol and my friend Jen Gunter have both publicly called out the supplement industry for misleading patients. More must be done. We must work with lawmakers to stiffen FDA regulations of the supplement industry, and we must walk back what many folks consider to be Senator Hatch's deadliest law, the 1994 DSHEA Act. We must call on the FDA to step up surveillance of supplements, and we must begin to require that these drugs are actually safe and effective prior to unleashing them on the public, just as we do with medical-grade pharmaceuticals. How many patient lives must be lost before we hold supplement makers accountable? That's the important question. I ask you today, would you take a supplement?